Hi, everyone, and thanks for joining me today to speak a little bit about health and wellness in the workplace. Before we really get into the presentation, I wanted to just introduce myself and go over a little bit of why I'm here, why I'm passionate about workplace wellness, and then we'll get into an overview of what we'll be taking a look at today. So, hi, I'm Caitlin Gass. I'm currently a graduate student at the University of New England in Portland, Maine. I am pursuing a master's degree in applied nutrition, and my expected graduation date is December of 2020. My background is also stemming from nutrition, where I have a bachelor's degree in food science and human nutrition from the University of Maine, and I had a minor in exercise science. So, a little bit of background between nutrition and both the exercise aspect. My work experience has both been in the clinical setting within a hospital, assisting registered dietitians with working with patients and direct support. I more recently have moved into more of an office setting, much as all of you here, working in more of a corporate office. I have experience in the insurance business, in the absence management business as both a case specialist and a trainer. So I have a lot of experience with being able to present information to a group and really hope to bring that understanding to this group and hear how you really synthesize the information that we go over today and start to implement that into your daily life. So, I became passionate about wellness in the workplace because I have experience working in an office setting. And I really saw how the job started to take a toll on my coworkers, other employees in the building, and I really knew that there had to be some way that I could gain additional education on the topic of health and wellness within the workplace and develop tools to present that information to offices such as this to start trying to get everyone thinking about ways that they can start incorporating a healthy lifestyle into their everyday work. So that's a little bit about me. Let's just go ahead and jump into an overview of what we're going to be talking about in this education seminar today. So we're going to talk about what the problem is that we're seeing in the corporate world. Not only the corporate world, really the entire climate of society right now. We're struggling with the problem of obesity in the United States. So we're going to take a look at that. We're going to define some terms. We're also going to look at how that problem is affecting the workplace. We're going to talk about sedentary work style, so being seated at a desk and having an office type of job with a lot of computer screen time. So I think that's really going to hit home for everyone because it's primarily what you're all doing in your daily work. We're going to talk about what wellness at the workplace is, ways to implement small changes, how it really affects the workplace as a whole. We're going to talk about just what the basic overview of nutrition recommendations for adults is. We'll take a look and just show you some resources where you can refer back to how you really should be eating on a typical day. We're going to include some information on how to implement healthy eating at work, some tips and tricks, an overview of why we need to be physically active, and again, tips on how to include that physical activity while we're at work. We're here for a lot of the time during the day, so we really want to learn how to make that time work for us. And then, of course, at the end, we'll have some time for questions and we can go over any topics or concerns that you might have. So let's just jump into the presentation here. So first, we're going to define the problem. We're going to define some terms here. We have overweight and obesity. And basically, as a group definition, it's an abnormal or excessive fat accumulation that might impair your health. So simple as that. We won't get too scientific with it. But how do we come up with if someone is overweight or obese? We're going to look at calculating their BMI. This is oftentimes done when you go to your doctor's office visits. You might see that on your discharge paperwork. Basically, it's commonly used to classify overweight or obesity in adults. We calculate that by a person's weight in kilograms divided by the square of their height in meters. So a simple calculation can determine what your BMI is. An overweight BMI is greater than 25, and an obese BMI is greater than or equal to 30. So we've defined the terms. We know a general overview of what overweight and obesity is. Now let's take a look at some of the statistics and circumstances that are surrounded with these terms. So we've got the problem, obesity in the US for adults. We have a chart here that shows the prevalence of obesity and how it's risen over the past few years. There is an uptake, and the US obesity prevalence in 2015 to 16 was documented as approximately 39.8% of adults. This is 93.3 million adults affected within the nation. It's a staggering statistic, but by going through and evaluating our everyday life, how we implement healthy eating, how we implement physical activity, we can take steps to slowly start to remedy this. The issue is that there is many obesity-related chronic health conditions. We've got heart disease, we have stroke, we have type 2 diabetes, and we have certain types of cancer. There are many lifestyle factors that influence our predisposition to obesity. We have diet, lifestyle, and last but not least, we have genetics. Unfortunately, obesity-associated diseases are currently the leading cause of preventable early death. So, we've taken a look at defining the terms. We've taken a look at the statistics behind overweight and obesity. How does this affect us? How is this problem affecting our workplaces, specifically our office-based work settings? Full-time employees, as we know, spend on average a third of their day, 5 days a week at their workplace. Overweight or obese employees, as we've seen, have an increased risk of these chronic health conditions that we just spoke about. Employees are documented to miss about 450 million more work days due to health conditions than those employees that are non-overweight or obese. This, of course, causes issues for both the employee and the employer. We need to be there for our teammates when we work in an office setting. We are decreasing production for our employer when we are out of work for conditions that are preventable. This, in turn, for our employer causes increased claims through both workers' compensation and disability. So it's not necessarily just ourselves and our coworkers that we're affecting throughout the United States by those that are obese and overweight with their associated chronic health conditions. This affects the production, this affects your employer, and we obviously want to do the best work that we can for the employer that we're working for. So we want to ensure that we're living our healthiest life so we're not affecting our workplace. We've got two terms here that really come into effect when we're looking at how this problem affects the workplace. We have absenteeism. Pretty straightforward. This is when an employee is just simply not present at work, most likely due to a sick day, due to a health condition. This has cost the nation approximately $8.65 million, last cited in 2012, with a variance of 6.5 to 12.6% of costs stemming from obesity and obesity-related conditions. That's a staggering statistic there. But on the other hand, we have presenteeism, a little bit different, maybe not as a common term defined. But presenteeism is when an employee is at work, but with diminished on-the-job work performance due to a health or life problem. This can be from being overweight or obese. Just because you're not necessarily missing a day doesn't mean that your health is providing you with your best foot forward to perform your job properly. So that can be a really big piece that changes the way we're thinking and changes the way that we're working. Just because you're in the office doesn't necessarily mean you're present. This causes a decrease in production levels and employee quality of life, and it causes an increase in mortality and rates of depression or mood disorders. So, we've taken a look at the problem. We've again defined some terms. Let's look at the specifics of the job that you're performing in an office setting. Sedentary work at a desk in front of a screen primarily. This is the most common nature of work in the present day. It's seated for approximately 6 to 8 hours per day. We've seen an overall major conversion from past work. Previously in the US, it was more focused on manual labor and farming. Now we are performing more of automated and less manual jobs where we're at a desk, we're seated, and we're working on a computer. This unfortunately has led to a decrease in daily caloric expenditure of more than 100 calories per day due to that lack of manual labor, farming, and tasks that were performed outside of a seated position. Because of this, we have to place more focus on the workplace as a contributor to obesity, unfortunately. And so we're needing to find more and more ways on how to combat that. This is associated with an increased body mass index just based on the sedentary nature of work. And we'll get into more of how sedentary behavior really affects our lifestyle. Even if we are active outside of work, that seated position for the 6 to 8 hours per day without much movement is extremely detrimental. So how does workplace wellness work? How does it work when we're actually in the office? What are the different types of ways that we can implement wellness? So workplace wellness can be a program. It can be an organized program for employees by their employer designed to enrich their physical, mental, emotional, and occupational well-being. Wellness in the workplace, really above all though, comes from combined efforts of both the employer, the employee, and society to truly improve the health and well-being of workers. So again, it doesn't necessarily have to be a quote unquote program that has been implemented by your employer. It can be the employees and the employer taking a stand all together and finding ways to implement health and wellness into their daily life. And again, we're going to provide you some tips and tricks on how to kind of sneak that into your daily work life. Above all, the goal is to create a work environment that's more supportive of healthy behaviors, such as, of course, healthy eating, physical activity, stress management, and efforts to quit smoking. In this program, we're going to specifically try to focus on the healthy eating behaviors and implementing physical activity, but those two can go hand in hand with stress management and even efforts to quit smoking. It's a program that's not only encouraging individual behavior, but it's also aiming to reduce overall stressors at work that have a take-home negative effect on health behavior. So if we're eating healthy and we're trying to get that physical activity in at work, that can truly alleviate stressors at home, being worried about fitting that physical activity in, being worried about, oh, I'm home and I must prepare a healthy dinner. If we have been adhering to those policies throughout the day, it's going to be much less of a stressor when we get home at the end of the day. So, the $1,000,000 question. Why is it so hard to stay healthy and active at work? Unfortunately, it's a cycle. We've got constant seated sedentary work, and for most of you, in a fast-paced and high-demand stress environment. We have reduced time available for physical activity during the day due to that constant seated work, fast-paced, and high-stress environment, which leads to lack of time and unhealthy food choices. And that cycles right back to the constant seated work. So we have a cycle here that we're trying to figure out how we can break and how we can implement different pieces into each of these steps. So I just wanted to provide you, again, I said at the beginning of this presentation, just a place to go for nutrition recommendations for adults. So we've got them listed out here. Basically, we want to make half your plate fruits and veggies, half your grains, whole grains, try to focus on low fat and fat-free milk or yogurt, vary your protein, and focus on consuming less sodium, less saturated fat, and less added sugar. So these recommendations are provided by MyPlate. We can provide you with the web address to research further on your own if you're questioning specifically how this is going to apply to you. I have a little bit of additional information on the following slide as well. But we really want to work on creating a healthy style of eating and a lifestyle centered around it rather than a diet. If you're focusing more on lifestyle changes rather than a specific diet, it's going to be something that you can adhere to more regularly rather than feeling like you're missing out on pieces of your diet. Focus on whole fruits and veggies. Add color to your diet with those fruits and veggies. And then think about the drinks that you're having. Really put emphasis on water. And we're going to show you some tips on really how you can take these recommendations and put pieces of them into your daily life at work. So again, I just wanted to show you where you could go to get more information on the nutrition recommendations for adults, the choosemyplate.gov website. I did provide a basic overview for food group amounts based on a 2,000 calorie a day diet, but this is a great website that you'll have access to at the end of this presentation and for future use beyond just this presentation to do some additional research and educate yourself on how these nutrition recommendations fit into your daily life. So before we get into the tips on how to really incorporate healthy eating and food choices into your work life, I really just wanted to point out that healthy defaults are choices we make in everyday life that require the least amount of effort or thought, but still produce healthy behaviors. So keeping this definition in mind as we move through the tips and tricks to implement healthy eating and implement physical activity in the workday is really just going to show you that we just want to make it as easy as we can for ourselves. We don't want to feel that physical activity and healthy eating is out of reach. We really just want to make those the easiest choices throughout our daily life at work. So, some tips to incorporate healthy eating habits in the workplace. I love this quote here at the top. Think back to your most productive workday in the past week. Now ask yourself, on that afternoon, what did you have for lunch? This is such a thought-provoking quote because I can think back to a day when I've been in the office and I've been starving and I've gone out for that pizza and I've come back and I am extremely sluggish. I don't have any motivation to do anything. I'm ready to take a nap. But then I think back to the day where I meal prepped and I brought in my salad with my protein on top and I had snacks available for me during the day. I was much more active, apt to be ready to work and get through the day. So these tips will kind of go hand in hand with that thought. So we want to work on making eating decisions before you get hungry. Don't wait till lunchtime to figure out what you're going to eat. Have that planned out, whether it's something that you're going to grab at the grocery store or at a different lunch spot, or if you're going to plan on bringing in your food for that day, plan ahead. Make healthy eating the easiest choice. As I just said, we want that to be the healthy default. Graze throughout the day rather than waiting till you're starving. Have snacks such as almonds, whole fruit, or veggie slices at your desk and right in your line of sight so you can't miss them. Keep healthy snacks stocked in your vehicle for your commute to avoid stopping, such as at a coffee shop, such as at a fast food restaurant for junk foods or quick breakfast items. Keep whole fruit, sliced vegetables, rice cakes, nuts, and whole grain crackers in your car for your commute. As I said before, a workplace wellness aspect or program doesn't necessarily need to be implemented by the employer. Be a voice at your employer. Provide feedback on vending machine contents, cafeteria options, and the food provided at meetings. Work on substituting donuts or pastries for low-fat yogurt with fresh fruit. Prep your food for the week ahead. Go grocery shopping. Make that food over the weekend. Cut up veggies and fruit. You're less likely to deviate from that plan if you have your snacks and lunches planned out. And above all, make healthy habits a social event. Invite your coworkers to bring a healthy snacks and lunch with you and enjoy it in the break room or outside if the weather's good. This is just another quote that I really like. I think it's really thought-provoking. Those who think they have no time for healthy eating will sooner or later have to find time for illness. So we've talked about the sedentary work lifestyle and how that really comes into play with issues with being seated for 6 to 8 hours a day, but how can physical activity during the day combat a sedentary work style? So we have physical activity. It reduces mortality rates, promotes healthy growth and aging, prevents chronic disease. The workforce has moved to a stage of, as I've said, of modernization and automation. Jobs have become more centered on seated work with increased computer screen time. But as a sedentary employee, you can still be classified as an active person. It's important to incorporate activity into your daily work life. It's not always best to keep physical activity and work separate. Very, very important. Studies show that office workers who are seated at a desk in front of a screen for 7 hours or more do not have improved values for waist circumference, BMI, which we touched upon, or fat mass, even with an active lifestyle outside of work. So this is saying if you are sitting at a desk for 7 hours or more, even if you go home and you're going to the gym for an hour, you're not necessarily combating these three issues because of the fact that you are seated all day. You've got to break it up. You've got to break up that seated time. So again, the constant sitting, it takes a toll on the body. Movement and physical activity is imperative to break up that seated day in order to be considered active. Some quick examples. Have a standing desk or taking 2-minute breaks every hour to walk around inside the building. These are just some examples. We'll incorporate some more of these examples once we move on into the tips for physical activity during the workday. So again, much like the nutrition recommendations, I just wanted to refine the recommendations for adult physical activity. We see here that the lack of physical activity is one of the leading contributors to obesity-related chronic disease. So I listed this out. We want to get at least 150 minutes a week of moderate intensity aerobic exercise or 75 minutes a week of vigorous aerobic activity. Or we can combine both. Be sure to spend less time sitting, which we're working on with that sedentary work lifestyle of how to implement physical activity during the day. And we want to just try to set goals. An example is setting a goal to reach 300 minutes of physical activity each week, which is double the recommendation. So just trying to meet the recommendation and then beyond that, even setting goals to double it. So let's get into the tips for incorporating physical activity in the workplace. Another quote I love, regular physical activity is one of the most important things you can do for your health. It's something you can do for yourself. Take advantage of it. Take advantage of any fitness facilities that are at your office. Do you have a gym? Is there walking paths outside? Take advantage of them. Examples, you could arrive 20 minutes early or stay 20 minutes after work. Use the gym, use the walking paths. Simple things, even outside arriving early or staying late. Plan to take the stairs whenever possible over using that elevator. Find reasons to go to other floors of the building when you're taking a break to use the restroom or just fill your water bottle. Create those healthy habits with your coworkers. I've said it before when it comes to healthy eating, but with physical activity, you can make that a social event. Make it a nice break for both exercise and social time. Take those 20 to 30 minute walks outside in the middle of the day, or if the weather's poor, walk around the building inside. Walk up and down the stairs. Find ways to just incorporate that, take a break, and enjoy the time with your coworkers. Some additional tips can be, we talked about a standing desk. You could ask your employer about the possibility of incorporating a standing desk. I've seen these workstations in the offices I've worked in. I've personally used one. It's a great tool to be able to sit and stand throughout the day as you please. You can also download an app for your smartphone, which I do have on my phone. It's called Stand Up. It alerts you when it's time to switch positions. I'd be happy to help anybody after the presentation downloading that or figuring out how to start using it. Get up from your desk. We talked about how even having an active lifestyle outside of work doesn't necessarily combat the sitting at your desk for 7+ hours. So get up from that desk hourly, even again if it's just to refill that water bottle. Take those breaks during the day to walk. Stand up. Get that short burst of exercise. That's how you're going to increase your activity at work. You're going to increase that productivity for your employer. You're going to increase your activity moving through your daily tasks, and you're just going to feel better overall. Another quote that I really liked when it came to exercise was, "Those who do not find time to exercise sooner or later will have to find time for illness." So much like that healthy eating quote, you're going to have to find time for something to go wrong if you're not taking those few minutes every hour to get that exercise in at work. It can be done. So we've gone over a lot today. We've gone over the problem, obesity and overweight. We've gone over the statistics and how that affects US adults. We've gone over what workplace wellness is and how you can really be a voice for change within your workplace without even really needing a true workplace wellness program developed. I've given you places to find further education on nutrition tips and physical activity requirements, and then we gave some tips on how to implement physical activity and healthy eating into the workday. So I just wanted to give you a summary of these key points for staying healthy and active at work before we took some time for questions. Simple chart. I really wanted to break it down for you here. Healthy eating. We're going to want to plan, prepare, and substitute. Plan. Go grocery shopping. Take a day during the weekend. Take an hour during the weekend and go grocery shopping. And then take that food and meal prep it. We can provide you a list of websites where you can go for some easy meal planning help and some sample grocery lists at the end of this presentation before we leave. We'll provide you with all of that information if you're kind of looking for a go-to place if you're just not sure where to start. Be happy to provide you with that information. We want to prepare. Have those healthy snacks in your car and at your desk. If you're not prepared and you don't have it with you, chances are you're more than likely to stop on your way to work. Stop at that coffee shop, stop at that fast food restaurant and pick up something that's not necessarily the most healthy for you at that time, not necessarily the best way to start your day. Also having healthy snacks in the car on your way home. You're getting out of work, it's not yet dinner time, but you're craving something. If you have that healthy snack, that rice cake, those whole fruits, those sliced vegetables in your car, you're more apt to take those rather than stopping and spending that additional money. And substitute. We spoke about getting up, filling that water bottle. Substitute your sugary drinks, your sodas, your fruit juices, just for plain water. And take that time during the day to get up and fill that water bottle. In terms of physical activity, we want to ask, we want to socialize, and we want to change. So we want to ask, we want to discuss options for possible sit-stand workstation, or we could use an app. We could ask your employer for that sit-stand workstation, or we could just try to get up and stand as we're doing our daily life at our desk. We want to socialize. We want to implement our coworkers into our program. Walk during lunch for those 20 or 30 minutes with your coworkers. Talk. It'll go by exceptionally fast and you'll have gotten a lot of steps in. And we want to change. We want to avoid that elevator. We want to take the stairs. Set goals with yourself. This is something that I used to do when I worked in an office setting. I would set a goal for myself every single morning I won't take that elevator to the third floor. I'll take the stairs. And I had that goal for me every morning. And at the end of a month, I realized I'd taken the stairs every day. And I was noticing it was getting easier and easier as I did that. So this is a great summary chart. You'll have access to this PowerPoint after we leave to go back in, take a look at different things, and see how that really fits into your daily work life. So I want to thank you all for taking the time to join us today to discuss the importance of workplace wellness. It's something that's near and dear to my heart. I really have a passion for it just because I had that experience working in an office setting, in a corporate setting, with a primarily seated sedentary job with exceptional amounts of computer and screen time, where I did find it was hard to get up. I found it was difficult in that fast-paced work environment where you felt you had to get work done. But what you need to realize is that your health and your wellness is so important to not only yourself, your family, your friends, but to your employer as well. If you're not healthy, if you're not well, and you can't not only come to work, but be present and active at work, you're more of a detriment than a help. So again, thank you. I will take any questions, comments, or concerns at this point. I'd be happy to answer anything for you. Again, I'll provide you with some ongoing resources to go ahead and find any grocery shopping or meal planning lists if that would be a benefit. But again, thank you, and we'll take any questions or concerns at this point.